Hello, welcome to my frequently asked questions. Well, today this is a follow-up to a video that I made which I answered the 10 most commonly asked questions by our patients. And this video is about the 10 most important questions that patients should ask but don't always ask us. And so why is this important? Well, I'll come on to that in a minute. And in a way, everyone is looking for an improvement in certain aspects of their appearance. And in terms of an improvement, well, we really want the surgery to be successful and you to achieve your expectations. But we also want you as a person to have a good experience or a fantastic experience. And we want to avoid issues, the need for revision surgery. About 20 to 30% of all the patients I see have had surgery elsewhere that could be classified as revision surgery. And also we want to avoid unnecessary issues. We want you to have a smooth journey, a pleasant experience, and achieve what you're set out to achieve. So, I'm just going to quickly look at, this is a disaster in terms of a 22-year-old who had eyelid surgery, and she had an extreme outcome that should never happen. Another person who was on breakfast television who had a procedure that they saw on social media and a quite unsatisfactory result. How can we avoid these kind of issues? And of course, unnatural appearance. This is Nicole Kidman, and certain times she's been photographed. Well, she can look fantastic, but also sometimes she can have too much treatment and that can look unnatural. So how can we avoid these kind of issues? My name is Dr. Julian De Silva. I'm a London-based oculofacial plastic surgeon, and this is what I do every day in, day out. This cannot constitute a medical consultation, but it is really for information and educational purposes. So firstly, who will I see at my consultation? Well, really, if you go to a reputable place, you will see the surgeon who's going to be completing the procedure or surgery. And sometimes certainly in London and other healthcare centres, there can be a person representing the surgeon, a non-medical person. It could be like a sales assistant, but of course it will be called something else. And they will talk you through the procedure and potentially book you for the procedure like a patient coordinator. However, when it comes to, although that may be okay for certain things, for facial surgery, which is inherently sophisticated and needs to be tailored to you, the individual, you really need to see the surgeon because there's so much artistry involved. And sometimes in London, well, you can be offered like a consultation in a clinic that's where the room has been hired for that one purpose, or you can be seen in a fancy London hotel. And actually the procedure or the surgery is not only conducted in a different place, sometimes that can even be a different country. And really that comes down to hospital tourism, and really you want to be seen in the surgeon's office where they're going to be completing the procedure, because that's going to give you the best kind of overall experience and best results from surgery. And when it comes to facial surgery, well, the eye is really in the detail. We want you to have the best possible results, and that detail, which comes down to millimeters, can only come with a really kind of thorough appointment, which really means you being seen in the clinic. What are the surgeon's qualifications? So there's a lot of different types of qualifications. Board certification is often the terminology used in the US, but doesn't necessarily apply in Europe. Myself, I'm an occupational plastic surgeon and I specialize only in the face. Well, there's 4 real categories of like surgeons that specialize in facial surgery. And there's general plastic surgeons, surgeons who do plastic surgery of the body and do reconstructive surgery. And there are ENT surgeons who specialize in otolaryngology, and those are surgeons who then sometimes specialize in facial plastic surgery. There are ophthalmologists who specialize in oculoplastic and oculofacial plastic surgery. And then, of course, there are also dentists who've also trained in medicine as well, and they're sometimes termed maxillofacial surgeons. And so all of these surgeons can specialize in the face and have what's described as board certification. I also have done additional training in the US and have board certification in facial cosmetic surgery. And there are many different other types of doctors and surgeons as well. In the UK and in many parts of Europe, you don't need to be a doctor or a nurse or have any medical qualifications to do certain non-surgical procedures, and that includes like fillers. But there are some inherent risks with these procedures, and really, if you want the best results and to avoid some quite serious issues, it's worthwhile seeing a specialist because they will be able to honor you with the best quality care. I specialize only in facial surgery, but there are other doctors who specialize in other areas of bodies. There are some plastic surgeons who really just do breast surgery, other surgeons who just specialize in liposuction. And so really, when it comes to your face or any aspect of your body, you really want to see someone who specializes in the area and is doing that kind of surgery all the time. Is the surgeon and the centre fully insured? So certainly in the UK, we have a lot of regulation that is really defined to help patients ensure safety and also a commitment to high quality care. So for example, even like in a clinic setting, every single wash basin has to follow the criteria set by the CQC. There can be no overflow of any taps. Now that might not seem a big deal, but the potential is for infection. So seeing a doctor or surgeon in a reputable place that has CQC confirmation, well, that gives you extra level of protection. Now, there's so much detail within this, and although, say, with facial surgery, infection is rare, infection can happen with any surgery. We have in our private clinic, our private hospital, 7-layered filter system of the water to protect every patient from these kind of issues. Now, if you see a doctor or a surgeon outside this, and that might be hospital tourism, going abroad, overseas for surgery, in Europe, Turkey, other places, you really don't know what that regulation is, and you don't know what the indemnity is either. Is there insurance if anything goes astray? I personally would really encourage you to have treatment and surgery in a safe environment to get the best possible results and peace of mind. Question 4, how often do you perform these procedures? So in modern day medicine, particularly with facial surgery, it's become so high level detail and skilled. Now, to give you an example, various like parts of the face, whether it's eyelid surgery, rhinoplasty, nose surgery, face and neck lift surgery, well, some of the conferences for these procedures on the face can be as long as 5 days, just looking at the nose, for example. And the level of detail that we go into in those kind of medical conferences is really millimeter perfect. There'll be talks on, say, one aspect of the nose, say the tip of the nose, for a whole hour. Now, it's impossible in modern day medicine to know everything about everything. You really need to specialize. So when it comes to your face, you really want to see a surgeon who's performing those procedures all the time. Now, for me, blepharoplasty, face and neck lift surgery, rhinoplasty, these are procedures that I do every day for my patients. Now, body surgery, well, there can be doctors who specialize more in body surgery, and depending on what that is, we can make recommendations for who is best to be seen in that area. Can I see before and after photographs? So personally, I have hundreds of photographs of my patients on the website, and those patients, well, there are many different ethnicities, there are many different facial characteristics. Some patients are looking for very natural, fine results. Some patients are looking for a bit more of a change. Some patients have facial aging and looking for rejuvenation, which often means lifting and adding volume, improving the quality of skin. Whereas some of my patients, well, it could be something genetic. It could be that they had eye bags at the age of 19 or 20 and they've progressively got worse, but they've always hated those eye bags. Or maybe another person who's always hated their neck or always hated their nose. And so you really, as people, we often look for someone who looks just like us. So it's worthwhile looking at lots of before and after photographs. Now, some of my patients, particularly from certain ethnicities, really don't want to share their photographs, and of course we completely agree with that. But some of my patients kindly agree that I can show patients their photographs in my office but not show them publicly on my website. So for some procedures, some patients, I'm able to show specific facial characteristics once I've seen you in my clinic, which I can't share publicly. I also some of my patients have been so kind to record both video diaries and video testimonials. And video diaries are where patients have kindly recorded every day after the surgery for a period of 2 weeks. And every day they've just described how their healing and recovery has been. And sometimes there could be a bit more swelling on one day, some day there might be a bit of bruising, but that can give you a really good idea of what the healing is and what the recovery is. And so I encourage patients who are a little bit anxious or nervous to look at this kind of information, because it can really give you further insight and information that can help you make a decision what's right for you. Some of our patients who are particularly nervous like to speak to a patient who's had surgery, and fortunately many of our patients are very appreciatively are happy to speak to those patients and describe how their experience was. Question 6. Do you feel you can give me the result I'm looking for? Now, in terms of facial surgery, the eye is always in the detail, and many of my patients, well, if I don't really believe I can get to the expectations you're looking for, I will be completely sincere with you and advise you accordingly that perhaps I'm not able to help you. For patients that I can help, well, also it's about expectations, because facial surgery is to a degree is artistry. Now, there are certain parts of the face that we can measure to a millimeter and improve symmetry to a millimeter. However, there's also a degree of artistry in that there are many parts of the face that we can't measure to the millimeter. There's no definition of what's the perfect chin, the perfect nose. There's no measurement that we can do that is a kind of panacea, will give us the perfect answer, because there's a lot of individual variation in terms of height, in terms of your facial characteristics, in terms of your ethnicity, your skin type. So all of these things can play an important role. So the surgery very much has to be customized to you, focused about what you're looking to achieve. At the same time, there's a degree of artistry, and it's important to talk through, what can be achieved. Often some things can be very much achieved, some things may be a little bit more challenging, and there may be certain things that we just can't change. Your hair color, your eye color, these things are pretty much defined by your parents and genetics. Now, this often takes time to discuss, and so it's important when you have a consultation with your surgeon that there's enough time that you can talk through these aspects of the surgery and talk through the recovery. And I spend quite a long time with my patients because I really want to get a very good idea of what you're looking for, so I can be sure that I achieve exactly what you're looking for. 7. Where will the procedure be performed? So often when it comes to facial cosmetic, plastic surgery, well, it's performed in a private hospital setting. Well, I've built a custom-built facility which is specially made for facial plastic surgery. And that's at 23 Harley Street, which is the medical area in London. And we have an office there which enables us, if we need any kind of imaging, any kind of support, well, Harley Street is the medical area, so we can get that advice or support often in a matter of minutes. Often plastic surgery is also performed in the private hospital setting, which I used to use. I used to take my patients to 2 private hospitals in central London. but often the standard can never be quite the same or the service quite as personalized as a private operating theatre in a private hospital, because that just gives you a new level of patient satisfaction. Question 8, what is the recovery like? Well, of course, when it comes to recovery, it does depend somewhat on the procedure you're having and the implications of that surgery. So for most facial surgery, 2 weeks is a good period of time. And the common things are swelling and sometimes bruising. And for most patients, you can look pretty good, even 1 or 2 weeks after surgery. However, sometimes there can be other factors. If you've had previous surgery, well, there's going to be natural scarring, change in that natural anatomy, and that can give you a bit more swelling. There are also other factors, and I ask patients to complete quite a long medical form before surgery, and that medical form gives us an idea, because there's certain things that may tend to give you more swelling and recovery. If you take herbal medicines, well, we'll advise you how to stop herbal medicines before the surgery, because those can thin the blood and potentially give you more bruising. So there's quite a lot of detail involved in these aspects. Now, the other aspect of this is how can the recovery be enhanced? And I've spent years now innovating in this area to speed up patients' recovery. So, for example, I give most of my patients sedation anesthesia. And sedation anesthesia is much milder than general anesthetic. It means that you sleep during the surgery, but you're breathing yourself. All your kind of natural reflexes are working normally. Things like your blood pressure, well, it doesn't change very much during sedation. So things like bruising and swelling is very much reduced, which gives you faster recovery. And many facial procedures, the risk of bruising in my hands is between 10 and 20%, and most bruising will go within 2 weeks. Now, in terms of oxygen, well, oxygen is the way that the soft tissues in the face heal. So if we give you increased oxygen after the surgery, that enhances your recovery. So oxygen therapy I give my patients after longer surgery. So certainly face and neck lift surgery, well, I find that can really enhance patients' experience and recovery by giving oxygen therapy in the period after surgery. There are other techniques and tools that have got scientific evidence for, and we use light therapy after surgery. And I've pioneered different techniques with regenerative medicine in order to enhance recovery using your own growth factors to heal your body faster. Well, that offers not just the solution for some of the most difficult to treat medical conditions, but it also provides us with tools to enhance recovery after surgery. Question 9, how will complications be handled? Well, of course, no one wants to have complications, and we really want to minimize risks from surgery. And the first point that comes with that is taking precautions. And for example, with my patients, I ask patients to complete an almost 10-page questionnaire before surgery, and we're really looking for any factors that might be significant with surgery. For example, if you had relatively high blood pressure, we definitely want to control that before doing surgery, because it would give you not only more chances of bruising, but it does increase the risk of some serious issues. And so not only do we ask those questions, but we actually measure every patient's blood pressure before surgery. And that's just one example. And now, very occasionally, we do find that the blood pressure is raised. And if your blood pressure is raised, well, we definitely want to control it before, because then we can minimize those risks from surgery. Bleeding behind the eye and damage to vision is extremely rare, but very serious, because it potentially can damage the vision. I've never had a patient have that, but we take every precaution to avoid it. And if there was any bleeding behind the eye, it's quite treatable as long as there is a plan in place. For every patient I treat, I would be available if there was anything like that, and I would open up the office even if it was midnight, and I would treat that patient. It's never ever happened, but we have taken precautions to avoid it. What about expectations? Well, expectations from surgery. Well, it's important to discuss with your surgeon exactly what you're looking to achieve, and your surgeon is realistic in what can be achieved, because it'd be easy to promise everything, but it's important to deliver on what you promise. And then finally, the management of complications. Now, from my experience with facial surgery, complications are not so common. Many of the things we can reduce and avoid. However, it's not possible to avoid all complications in facial surgery because rare things can happen. And any surgeon performing facial surgery, well, you may have done that surgery hundreds, if not thousands of times, and then just one person will heal slightly different. Now, I personally offer a very personalized service, so any patient who needs me, I'll be there for, and I will manage them and will correct anything that is necessary. Sometimes it can be necessary to have like a refinement or revision surgery to improve that. Most of the time that's not necessary. Just about every surgical procedure has something very rare but very serious. And I was at a conference like recently where one of the doctors said where he had seen 3 patients who'd come to see him who'd had facial surgery like rhinoplasty, and they'd have a CSF leak after surgery. And CSF leak is the fluid around the brain, which is not directly related to the nose or having rhinoplasty. Now, personally, I've never seen that issue in any of my patients, and I take great precautions and treat all the anatomy delicately to avoid these issues. But the fact that a colleague of mine has had those issues, well, it's important that we factor that into account. And no one can guarantee you that you'll have 0 complications from surgery, because these things can happen. But it is important that you're well looked after and that you feel you trust your surgeon, so that if there was anything, that they can look after you and amend that as soon as possible. And then finally, question 10, what procedures would you recommend to achieve my goals? And so many of the patients who come to see me have like an area or several areas that they've particularly noticed. And it's very important when having surgery that those goals are achieved. Sometimes it's worth looking at the face as a whole, because it's important that the face is in balance. Now, for example, sometimes a patient will say to me, well, it's really the bump on my nose that really bothers me. But we really need to look at the nose as a whole. We need to look at the tip of your nose, because if the tip is a little bit wide and we improve the rest of your nose, we really need to do some refinement to the tip so your nose is in balance. Similarly with your neck, like some patients will come and see me and say, oh, I really don't like the loose skin and the changes in my neck. And when I look at their face, I can see they have like quite a recessed or small chin. And really for that patient, to give them the best long-term result that will last as long as possible and give them the best kind of facial balance and harmony, they might need a small chin implant in order to give them that improvement. Similarly with eyelid surgery and blepharoplasty, often like fat transfer can really enhance the results of that surgery, because it not only does 50 to 60% of that fat last long term, but it just makes the skin quality improved, and it makes the area of the lower eyelid much smoother, which gives a much better result. And although without fat transfer the surgery might take 30 to 40% less time, we really want to do the surgery and procedure in a way that it's going to give you the best result and best long-term result for years to come. So in summary, the 10 questions that you should really think about when you see your doctor, your surgeon. Who am I seeing? Am I seeing the surgeon? Have I had an opportunity to really talk to the surgeon who will be performing that procedure with me? What are the surgeon's qualifications? And we talked about facial specialization and board certification. Is the surgeon in the center fully insured? Well, certainly in the UK, there's a lot of regulation that protects your interests as a patient and gives you the best quality of care. How often does your surgeon perform those procedures? And that is really important. Can I see before and after photos that are relevant to me? Can I see the qualities or characteristics of the face that I really want to improve? Can you achieve the result that I'm looking for? Where will the procedure be performed? what is the recovery that's associated with that procedure, and make sure that you have time dedicated in order to have that recovery. Question 9, how will complications be managed? Of course, we want to avoid complications as far as possible, but if there is something, how will I be looked after? And then finally, what procedures do you recommend to give me the very best result? Well, I do hope this information has been helpful for you. If you have any thoughts or questions, please do not hesitate to contact me. Thank you for watching.